Revised Code of Ethics for Medical Technology. What is the purpose of Medical Technology Code of Ethics? The Code of Ethics outlines the expected ethical obligations and values that patients, the profession, and the general public believe will guide all medical laboratory technologies, professional, and personal behavior. So, for the first Code of Ethics, as I enter into the practice of medical technology, I shall accept the responsibilities inherent to being a professional. I shall uphold the law and shall not engage in illegal work, nor cooperate with anyone so engaged. I shall avoid associating or being identified with any enterprise or questionable character. How do medical technologies maintain professionalism? Example of this is to recognize, disclose, and respond appropriately to conflicts of interest that develop during professional activity. They will protect the privacy of personal health information, be transparent, and provide unbiased, patient-centered treatment. For the second Code of Ethics, I shall work and act in a strict spirit of fairness to employer, clients, contractors, employees, and in a spirit of personal helpfulness and fraternity toward other members of the profession. How do they demonstrate fairness? This implies treating everyone equally and being fair and just in your dealings with them. Make decisions without favoring anyone and without exploiting others. At work, every employee needs to be treated equally. When it comes to promotions, pay raises, or other possibilities based on job performance, this includes being treated with dignity, respect, and equality. I shall use only honorable means of competition for professional employment or services and shall refrain from unfairly injuring directly or indirectly the professional reputation, projects, or businesses of a fellow medical technologist. I shall accept employment from more than one employer or only when there is no conflict of interest. Medical technologists also shall perform professional work in a manner that merits full confidence and trust, carried out with absolute reliability, accuracy, fairness, and honesty. They must also review the professional work of other medical technologists when requested, fairly and in confidence whether they are subordinates or employees, authors or proposal for grants or contracts, authors of technical papers or other publications are involved in litigation. Example of being reliable and accurate, a medical technologist is a highly trained healthcare practitioner who examines and tests blood, other bodily fluids, and tissue sample. Diagnostic information that is current and accurate allows healthcare providers to make clinical decisions that improve patients' outcome. So they shall advance the profession by exchanging general information and experience with fellow medical technologists and other professionals and by contributing to the work of professional organizations. What are the benefits of knowledge sharing in the workplace? Knowledge sharing is critical for a company's success since it allows for better decision making, the development of learning organizations via learning routine, and the stimulation of cultural change and creativity. And for medical practitioners can conduct their work better by sharing professional knowledge regarding best medical procedures and the latest information. It encourages good decision making abilities. Managers and physicians can be hampered when individuals in your business lack knowledge or are overwhelmed with data. Implementing a knowledge management system will improve the flow of information, leading to improved decisions and outcomes. Medical technologies shall restrict praises, criticism, views, and opinions within constructive limits and shall not use the knowledge know for selfish ends. They shall treat any information acquired about individuals in the course of any work as strictly confidential and may be divulged only to authorized person or entities or with consent of individual when necessary. What is effective healthcare communication? Clear, timely, and discreet communication between healthcare workers is essential. This communication is required in order to establish accurate diagnosis, administer appropriate treatments, and ensure that patients understand their health state and requirements. Technologies shall report any infractions of these principles of professional conduct to the authorities responsible of enforcement of applicable laws or regulations or to the Ethics Committee of the Philippine Association of Medical Technologies as may be appropriate. To this principle, they must hereby subscribe and pledge to conduct themselves at all times in a manner benefiting the dignity of their profession.